In this video we will learn following aspects of growth hormone and prolactin, release of growth hormone, effects of growth hormone, inhibition of growth hormone, growth hormones promotes, dwarfism, acromegaly, prolactin, increased levels of prolactin, low levels of prolactin. Release of growth hormone. 1. Hypothalamus releases growth hormone releasing hormone. 2. GHRH triggers anterior pituitary hormone. 3. Anterior pituitary hormone releases growth hormone and somatotropin. 4. Target organs of GH are liver, muscle, bone, kidney. 5. Liver releases insulin like growth factor 1. Effects of growth hormone. There are 3 types of growth hormone effects: glucose-sparing effect, growth effects, diabetogenic effect. First growth hormone effect is glucose-sparing effect. Glucose-sparing effect: stimulate adipose cell, break stored fat, lipolysis. Lipolysis produce energy, which can be used as fuel for growth effects. Following are the growth effects and target organs on which growth hormone act. First, increase uptake of amino acids. Second, enhance cellular proliferation. Third, decrease apoptosis. And target organs on which growth hormone act: bone cells, muscle cells, nervous system cell, immune system cells. Third growth hormone effect is diabetogenic effect. 1. Stimulate liver to break down glycogen into glucose, glycogenolysis. 2. Glycogenolysis produce energy, which is used as fuel for growth effects. 1. Liver releases insulin growth factor 1, IGF-1. 2. IGF-1 stimulate growth effects on bone cells, muscle cells, nervous system cell, immune system cells. Inhibition of growth hormone. Increased level of insulin growth factor 1, IGF-1. Hypothalamus detect IGF-1 levels. Hypothalamus releases growth hormone inhibitory hormone, GHIH. GHIH inhibit growth hormone release from anterior pituitary gland. Growth hormones promotes protein synthesis, not proteolysis, lipolysis, increase muscle mass, osteoblast, for bone growth and mineralization, cartilage growth, works with thyroid hormone. Dwarfism. Dwarfism is short stature that results from a genetic or medical condition. Dwarfism is generally defined as an adult height of 4 feet 10 inches, 147 centimeters or less. The average adult height among people with dwarfism is 4 feet, 122 centimeters. Many different medical conditions cause dwarfism. In general, the disorders are divided into 2 broad categories. Disproportionate dwarfism. If body size is disproportionate, some parts of the body are small, and others are of average size or above average size. Disorders causing disproportionate dwarfism inhibit the development of bones. Proportionate dwarfism. A body is proportionately small if all parts of the body are small to the same degree and appear to be proportioned like a body of average stature. Medical conditions present at birth or appearing in early childhood limit overall growth and development. Causes of disproportionate dwarfism. 1. The most common cause of dwarfism is a disorder called achondroplasia, which causes disproportionately short stature. 2. Another cause of disproportionate dwarfism is a rare disorder called Spondyloepiphyseal dysplasia congenita, SEDC. Achondroplasia symptoms. This disorder usually results in the following: an average-sized trunk, short arms and legs, with particularly short upper arms and upper legs, short fingers, often with a wide separation between the middle and ring fingers, limited mobility at the elbows, a disproportionately large head, with a prominent forehead and a flattened bridge of the nose, progressive development of bowed legs, progressive development of swayed lower back, an adult height around 4 feet, 122 centimeters. Spondyloepiphyseal dysplasia congenita, SEDC. Symptoms. Signs may include a very short trunk, a short neck, shortened arms and legs, average size hands and feet, broad, rounded chest, slightly flattened cheekbones, opening in the roof of the mouth, cleft palate, hip deformities that result in thigh bones turning inward, a foot that's twisted or out of shape, instability of the neck bones, progressive hunching curvature of the upper spine, progressive development of swayed lower back, vision and hearing problems, arthritis and problems with joint movement, adult height ranging from 3 feet, 91 centimeters, to just over 4 feet, 122 centimeters. Proportionate dwarfism symptoms. Signs include height below the 3rd percentile on standard pediatric growth charts, growth rate slower than expected for age, delayed or no sexual development during the teen years. Dwarfism-related conditions. Disproportionate dwarfism. The characteristic features of the skull, spine and limbs shared by most forms of disproportionate dwarfism result in some common problems. Delays in motor skills development, such as sitting up, crawling and walking, frequent ear infections and risk of hearing loss, bowing of the legs, difficulty breathing during sleep, sleep apnea, pressure on the spinal cord at the base of the skull, excess fluid around the brain, hydrocephalus, crowded teeth. Dwarfism-related conditions. Proportionate dwarfism. With proportionate dwarfism, problems in growth and development often result in complications with poorly developed organs. For example, heart problems that often occur with Turner syndrome can have a significant effect on health. An absence of sexual maturation associated with growth hormone deficiency or Turner syndrome affects both physical development and social functioning. Acromegaly. Acromegaly is a hormonal disorder that develops when your pituitary gland produces too much growth hormone during adulthood. Acromegaly signs and symptoms. Acromegaly signs and symptoms tend to vary from one person to another, and may include any of the following: enlarged hands and feet, enlarged facial features, including the facial bones, lips, nose and tongue, coarse, oily, thickened skin, excessive sweating and body odor, small outgrowths of skin tissue, skin tags, fatigue and joint or muscle weakness, pain and limited joint mobility, a deepened, husky voice due to enlarged vocal cords and sinuses, severe snoring due to obstruction of the upper airway, vision problems, headaches, which may be persistent or severe, erectile dysfunction in men, loss of interest in sex. Acromegaly causes. In adults, a tumor is the most common cause of too much GH production. Pituitary tumors. Most acromegaly cases are caused by a non-cancerous benign tumor adenoma of the pituitary gland. The tumor produces excessive amounts of growth hormone, causing many of the signs and symptoms of acromegaly. Non-pituitary tumors. In a few people with acromegaly, tumors in other parts of the body, such as the lungs or pancreas, cause the disorder. Sometimes, these tumors secrete GH. In other cases, the tumors produce a hormone called growth hormone-releasing hormone, GHRH, which signals the pituitary gland to make more GH. Acromegaly complications. If left untreated, acromegaly can lead to major health problems. Complications may include high blood pressure, hypertension, high cholesterol, heart problems, particularly enlargement of the heart, cardiomyopathy, osteoarthritis, type 2 diabetes, enlargement of the thyroid gland goiter, precancerous growths, polyps on the lining of your colon, sleep apnea, a condition in which breathing repeatedly stops and starts during sleep, carpal tunnel syndrome, increased risk of cancerous tumors, spinal cord compression or fractures, vision changes or vision loss. Prolactin. Prolactin is a hormone produced in the pituitary gland. named because of its role in lactation. It also has other wide-ranging functions in the body, from acting on the reproductive system to influencing behavior and regulating the immune system. Function of prolactin. Prolactin is a hormone named originally after its function to promote milk production lactation in mammals in response to the suckling of young after birth. These can be divided into a number of areas: reproductive, metabolic, regulation of fluids, osmoregulation, regulation of the immune system, immunoregulation, behavioral functions. Production of prolactin. In humans, prolactin is produced both in the front portion of the pituitary gland, anterior pituitary gland, and in a range of sites elsewhere in the body. Lactotroph cells in the pituitary gland produce prolactin, where it is stored and then released into the bloodstream. Human prolactin is also produced in the uterus, immune cells, brain, breasts, prostate, skin and adipose tissues. How to control prolactin release. One of the main regulators of the production of prolactin from the pituitary gland is the hormone called dopamine. Dopamine restrains prolactin production, so the more dopamine there is, the less prolactin is released. Prolactin itself enhances the secretion of dopamine, so this creates a negative feedback. Estrogen is another key regulator of prolactin and has been shown to increase the production and secretion of prolactin from the pituitary gland. This is also the case during and after pregnancy, which makes sense, since a higher level of circulating prolactin is needed to cause lactation to start. Hyperprolactinemia. The condition of having too much prolactin circulating in the blood is called hyperprolactinemia. Causes. The most common causes of hyperprolactinemia include pregnancy, medications that reduce dopamine action in the body, thyroid underactivity, and benign pituitary tumors, known as prolactinemia. Symptoms can include the unwanted production of milk, disturbances to the menstrual cycle, and symptoms due to estrogen deficiency in women or testosterone deficiency in men. Treatment. The vast majority of patients with a prolactinoma can be treated successfully using drugs which mimic the action of dopamine. The most commonly used is gabergeline. Hypoprolactinemia. Definition. The condition of having too little prolactin circulating in the blood is called hypoprolactinemia. Cause. This condition is very rare and may occur in people with pituitary underactivity. Symptom. A decrease in the amount of prolactin secreted can lead to insufficient milk being produced after giving birth. Most people with low prolactin levels do not have any specific medical problems, although preliminary evidence suggests they might have reduced immune responses to some infections. Learn terminologies with MJM.